Welcome. Today I'm here to present and talk to you about a new standardized preoperative instruction proposal for UPMC PASVIT and their surgical department. So let's dive right in. What is the objective of wanting to create new standardized preoperative instructions for the PASVIT surgical services, particularly focused on the call room nurses? So the objective of this proposal, creating new standardized preoperative instructions, are to develop clear, comprehensive preoperative guidelines for call room nurses to be able to follow to guide patients on how to best prepare to come in for their surgical procedures. The purpose of this is due to the current preoperative instructions being kind of convoluted, contradictory, not clear in format. Additionally, a lot of the surgical and anesthesia teams kind of seem to be out of touch, not in good communication with the nurses as far as what information is actually being presented to the patient. So we want to seek an all new format that's going to be clear, concise, thorough, comprehensive instructions that these call room nurses can use to guide these surgical patients on how to best prepare for surgery. So the goal then is going to be to have these instructions in an electronic format presented on the Teams page to be accessible, modifiable by a few team members and viewable by all the other team members. The completion date projected for this project is going to be November 2025 of this year. So a little bit of background. So this proposal project is for UPMC PASVIT Hospital located in McCandless, PA. The current issue that we are facing is that there's no formal preoperative instructions for call room nurses to prepare patients for surgery. These instructions have been built up over the last 175 years the hospital has been in existence from prior surgical teams and nurses input. And the problem we're seeing today is that these inconsistencies in instructions and confusion are actually leading to patients being canceled the day of surgery. So the goal of these new standardized preoperative instructions are to improve patient safety, improve our efficiency of the surgical services we provide, and to make sure that we are providing continuous quality improvements for our patient care. This proposal project is going to need a first initial approval by Dr. Grant and April Lazone, the manager of the surgical area that I work for, to be able to say that this project does appear to be beneficial and will serve to improve patient care at our hospital. Additionally, later on in the project, we will need a final approval from the hospital education department, the anesthesia teams, the surgical teams, all to be able to comprehensively look at these preoperative guidelines to say, yes, they are current evidence-based research behind them and will be used to help better prepare our patients more clearly and thoroughly to best come in and be prepared for our surgical procedures. So let's break these standardized preoperative instructions down a little bit. So the main goal here is we want standardized preoperative instructions. We want one main format of instructions available electronically for all the nurses, anesthesia team, and surgical teams to access. The intended users of this are going to be the call room nurses, the surgical teams, and the anesthesia teams. Those will be all the different main three primary teams that are going to be accessing these preoperative instructions to be able to modify and to view. The primary objective of creating these preoperative standardized instructions are going to be enhance patient care and reduce errors. The secondary objectives that we are going to be working to achieve during this proposal is also to improve patient satisfaction by having clear, more consistent instructions provided to our patients, and also to streamline communications between our surgical anesthesia teams and our nurses, so everybody's on the same page as far as which instructions need to be followed for patients to receive good preoperative surgical care. So let's break down, what is this proposal project going to involve? So it's going to be first looking at, from nursing, surgical team, and anesthesia perspectives, what is working and what is not working with our preoperative call room instructions. What is inconsistent in the instructions that needs to be improved upon. Also then gathering current evidence-based research practices from our hospital education department and outside evidence-based research articles to kind of further develop these preoperative instructions to be as thorough as possible. And then finally working to revise the instructions. So overall, really want this content and these new standardized instructions to be clear and thorough as possible, bringing in different elements of flowcharts and table of contents just to make sure they are simplified and easy to use. Upon completion of this project, it will be electronically uploaded to our hospital teams page, which every member of the hospital has access to, and then providing actual printed copies for the call room nurses to have at hand during the calls if that's easier for them. So one of the best ways to look at this proposal is to break it down into phases. This is how we're going to kind of make the flow of the procedure of rolling this out. So first phase, as I discussed, it's going to be interviewing, working with teams to kind of gather more information about how to best improve these new standardized instructions, what changes need to be made, and what aspects maybe we can leave the same moving forward. Phase two, after gathering all this information, is then to draft and revise the instructions to create a new standardized set of preoperative instructions with flow charts and educational images to best have our nurses use them as an educational resource to prepare surgical patients. Phase three, once we have these preoperative surgical instructions developed, then we're going to bring it back to the anesthesia teams and surgical teams to get their input. They're going to look at it and make sure it's aligning with what they want their patients to be prepared with for surgery. Then, once they provide us with the feedback of what revisions we can make, we're going to trial this. So this is going to be trialed with the preoperative call room nurses to see what is working during the calls and what maybe needs to be further revised to make it clearer for the call room nurses to provide instructions to patients. Then we are going to need approval for the final preoperative instructions once they have been trialed. Once they have been approved by the surgical, anesthesia teams, and hospital, then we can move forward to uploading these to teams and distribute copies to the call room nurses. So we're looking about an 8-month time span this year to get this completed. We're going to start in April doing those interviews. May, we're going to review the instructions and evidence-based practices, and then develop the new instructions in June. August is when we're going to seek that feedback from the anesthesia and surgical teams on how to improve the instructions. Then we're going to trial it in September and October and hopefully have a projected date to release it out to the hospital call room nurses in November of this year. So one of the great aspects of this proposal project is the only cost in doing this project is going to be printing the materials, which will just be getting ink and paper to print these packets, which currently will only need 14 packets printed for the call room nurses. So there's no additional cost there. One of the costs that won't be financial will be time. So we need to consider that majority of these workers are working on a salary-based income, so they need to work within their approved standard hours they're approved for to work, and we need to make sure that this project is not going to impact significantly the other aspects of work that need to be complete, whether that's for the anesthesia, surgical services, or nursing services. So in conclusion, this new standardized preoperative proposal project is looking to create standardized preoperative instructions for call room nurses to follow to improve patient care, reduce errors, and streamline communication among our surgical services. We are looking for a positive impact for our nurses, patients, surgical, and anesthesia teams combined to ensure consistency and better outcomes for our hospital here at UPMC. Thank you.